Yes, this is the family planning lecture. This is going to be the third module, and we are going to consider barrier methods. I still remain Dr. David Olusegun Awoleye. Let's look at the barrier methods of family planning. We have number one, we have the spermicides. Number two, we have the main condom. Number three, we have the female condoms. Number four, we have the diaphragm. Then we have the cervical cap. These are barrier methods. The spermicide is like a foam that is inserted into the vaginal orifice that will prevent the spermatozoa from penetrating to the uterus. Then we have the male condom that we all know. As we have the male condom, so we also have the female condom. Then we have diaphragm. We have diaphragm. Then we have cervical cap. Let's look at some of these things in form of the pictorial. We'll look at that in the next slides. The barrier method prevents pregnancy. It blocks eggs and sperm from mating. So barrier method prevents pregnancy by blocking the sperm from going to mate the egg. So it's going to block the spermatozoa from getting to where the eggs, that the ovum is. Barrier methods have higher failure rates than hormonal method due to design and human error. So barrier method has higher failure rates. That means they have low effectiveness compared to hormonal methods. And the reason is because of human error and because of the methods that we use for or to insert the method. So let's look at the spermicide. We take them one after the other, so we're able to look at how it functions. So it's a chemical that kills sperm in the vagina. So if you look at the diagram here, you see it's a chemical that is inserted to the vagina that kills the sperm. Sperm, they are living cells. So different forms. There are different forms. We have the one that is jelly. We have the one that is foam. We have the one that is suppository. So the jelly one, the foam one, then the suppository. Some works instantly, other required pre-insertion. So we have some that works instantly, and we have other that forms or that needs pre-insertion. Only 76% effective. It's only effective for 76% when you use it alone. So it is encouraged that you use it in combination with another method, e.g. or IA, that is condom. So use it with condom. If you want it to be effective, then use barrier method, the spermicides, use it with condom, because it has just only 75% effectiveness. So let's look at male condom. Male condom, most common and effective barrier method when used properly. Male condom is the one that is very common. Like the spermicide we talked about the other time, many of you might not be familiar with it. But for male condom, it's very common. And when it is used effectively, it has an effective, it is an effective barrier method. Yes, latex should only be used in the prevention of pregnancy and spread of STI, including HIV. So when you use condom, it's going to not just to prevent pregnancy, but also prevent the spread of sexually transmitted infection, including your HIV. The effectiveness rate is 88%, and the availability is very, very available. Combining method with spermicide raise effectiveness level to 99%. So when you now combine male condom with spermicide, then you have the effectiveness as or up to 99%. Now let's look at female condom made as an alternative to male condom. Female condom is made as an alternative to male condom, just like the male condom, only that it is used by the female, and it contains polyurethane. It contains polyurethane in the structure, and this can be physically inserted in the vagina. So you insert it in the vagina, and the typical rate of protection or prevention of pregnancy is 79%. So woman can use female condom if partner refuses to use male condom. So woman uses female condom when the partner refuses to use male condom. This is how the female condom looks like, just like the male condom, but it's a little bit wider. And if you look at it, it's wider, especially at the edge, and it has a form of cap at the edge to cover the cervix, so that it's going to protect the cervix from receiving the sperm. If you look at it here, you have the closed end. Closed end is not like that of condom, male condom. The open end, look at the open end. The closed end looks like diaphragm, the head of the diaphragm. It's a funnel like that can cover or have the ability to cover the cervix. Then we have the open end as a female condom, and what it does is it covers or it protects or prevents the spermatozoa from getting or penetrating to the uterus. Female condom block sperm from entering cervix. Look at it. It blocks the sperm. This is it, fixed to the cervix. It blocks the sperm from entering cervix. A female condom is a lubricated polyurethane sheet. It's a lubricated polyurethane sheet similar to male condom. And inserted into the vagina. This closed end covers the cervix, just like your diaphragm. Then once it covers the cervix, it is expected that the spermatozoa enters into the condom, and the individual can remove the condom at the end of the sexual intercourse. So let's look at vaginal ring. That's another barrier. That is the Nuva ring. That's 95 to 99 effectiveness. It's a new ring that is inserted into the vagina each month. This one does not require a fitting, does not require a fitting by a healthcare provider, does not require spermicide, can make period more regular and less painful, no pill to take daily, ability to become pregnant returns quickly when use is stopped. So for Nuva ring, for vaginal ring rather, for Nuva ring, it is very, very effective. It has 95 to 99% effectiveness. This is a new ring that is inserted into the vagina, and you do this every month. And this does not require you calling for an health worker or a doctor to insert it. It doesn't require that, and does not require spermicide. In case of other barrier method, we say okay, it's better you use it with spermicide, but this one does not require spermicide and can make period more regular. So it can make your menstrual flow to be more regular and less painful. Then for this, you don't need to take any pills. So, and when you want to become pregnant, Nuva ring will help you to come back to be pregnant immediately. Nova ring is a flexible plastic. It's ethylene, phenane, acetate, coponemer. The ring releases a low dose of a progestin and estrogen over 3 weeks. Release very low dose of progestin and estrogen over 3 weeks. So we have another barrier method as the diaphragm. Diaphragm, typical effectiveness of diaphragm is 80%, and there is a latex barrier too placed inside vagina during intercourse, and this needs to be fitted by a physician. Spermicide jelly before insertion. So we need to use spermicide jelly before you insert the diaphragm, and then inserted up to 18 hours before intercourse, and can be left in for a total of 24 hours. So the diaphragm can be inserted 18 hours before intercourse, and you can leave it for 24 hours before you remove it. So diaphragm, this is the pictorial form of diaphragm. You lubricate it with spermicide, then you insert it, and always better inserted by a physician to cover the cervix. And then we say we can leave it for at least 24 hours before you remove it, and it's expected to be inserted 18 hours before the intercourse. So that is that. The diaphragm, look at how it looks like. And the next thing is cervical cap. It's also a latex barrier that is inserted to vagina before intercourse as well. It's a cap around cervix with suction. It's a cap around the surface with suction, filled with spermicide jelly prior to use. So you have to fill it with spermicide jelly before you use. You can leave it in the body for up to a total of 48 hours. You can leave in the body for a total of 48 hours and must be left in place 6 hours after sexual intercourse. So before you remove it, you must make sure that it stays in your body or left in place 6 hours after sexual intercourse. The perfect effectiveness rate is 91%, but typical effectiveness rate is 80%. So that's cervical cap. Is how it looks like. You can use it. You look at is a barrier method. You can fix it to the edge or to cover the edge of the cervix. To cover the edge of the cervix. But before you use it, you have to put spermicide. You have to put spermicide to it so that it will prevent the sperm from entering into the vagina, to the uterus. And the spermicide there will definitely kill the spermicide will kill the sperm as enter. Then we have spongy. Spongy is just look at it now. It's a hair. Look at it. So you put it inside. It's also a barrier method. Covers the cervix. Spongy absorbs sperm, preventing them from entering into cervix. So once you put it to cover the area of the cervix, it's going to absorb sperm and it will prevent it from entering into cervix. So spermicide inside the diaphragm, inside the diaphragm kills sperm. So when you put the spermicide there, it's going to kill the sperm. In the next class, we are going to look at intrauterine device as IUD, and we'll look at it into detail. Once again, I want to encourage you, try as much as possible to go through your notes and read it, listen to the audio, read the PowerPoint, and then very soon we're going to call for an interactive moment when you can ask your questions. I still remain Dr. David Olusegun Awule. Thank you very much. God bless you.